Oh my God, osteomyelitis. Osteomyelitis is defined as an infection of the bone. When the joint is also involved, it is called osteoarthritis. The roots of spread can be hematogenous directly from the adjoining tissue over here, and it can be via the external source. So these are the three sources. Draw this diagram. And this is the picture which I shall be explaining again. The predisposing conditions are diabetes, focus of infection elsewhere, such as a caries tooth, gingivitis, etc. Abscess, vegetations from the infective endocarditis. Disseminated infections such as pyelonephritis or meningitis. Typhoid, road traffic accidents. These are all some predisposing conditions. Organisms can be gram-positive, gram-negative, special organisms like typhoid or tuberculosis or syphilis, and fungi. This is the diagram which you people will have to draw. So the green one is the sequestrum or the dead bone around which you have got a new bone formation. And there can be a sinus tract leading to this. And sometimes it can enter the joint space by heart. Pathogenesis. Please draw this diagram and explain. There is a focus of infection and it can go to the metaphysis and the periosteal tissue. The epiphysis is usually protected, but via the bursa it can go into the joint space. Please draw this diagram. The bones such as tibia are all more involved as they are less vascularized. So this particular diagram I would like you to draw. Look at this one. This is a periosteum over here. A is a normal bone and C is the involucrum or the reactive new bone. E is the sequestrum or the dead bone and D is the sinus tract. This is very, very important. Draw this one. And in acute osteomyelitis microscopy, please remember neutrophils will be there. Cells with irregular nuclei. In chronic osteomyelitis, radiologically it is called as Brody's abscess or a sclerosing osteomyelitis. Whenever there is not a very severe infection, subacute infection, this can happen. Also, it can happen in tuberculosis, etc. So, in tuberculosis, I have already told you, you can draw the diagram of the granuloma. Epithelioid cells, lymphocytes, fibroblasts, Langerhans giant cells, and areas of necrosis. So, these are the sources. Sometimes from the spine there can be an abscess to the thigh and that is called as psoas abscess. Syphilitic osteomyelitis, it can be acquired or congenital. Two things alone you people can remember. One will be infiltration with plasma cells and two will be obliterative endarteritis. There is a saber tibia that can happen in congenital syphilis. Thank you.